Now, irritable bowel syndrome is one of the conditions that can arise, and again, it is going to present to you with the abdominal pain. The patients of the irritable bowel syndrome are basically referring to a condition of inflammation that is occurring in the colon. And again, it's a long-term condition. It is a chronic condition that he or she is suffering from. The patient would also have associated symptoms of bloatment, belching, and again, the generalized kind of an abdominal pain. The episodes of diarrhea and constipation are usually suggestive of the fact that the patient is suffering from inflammatory or irritable bowel syndrome. It is a diagnosis of exclusion. What do you mean by that? It's basically when you exclude all the other diagnoses, usually you resort to the phenomena that the patient is suffering from this irritable bowel syndrome. Again, lifestyle modifications and diet modifications are sometimes proved to be very fruitful for patients of irritable bowel syndrome.